So, Lucetta, before we talk any further about sort of what brings you in today and what's going on with your health, I want to back up for a second and just review our confidentiality policy, if that's okay.
Okay.
So, I know that you signed the HIPAA form out in the waiting room, and you've probably signed that in other places. And that's about a federal law that requires us and all healthcare providers to protect your privacy and the privacy of your information. So it is illegal for us to share information about you or your health condition with anyone outside of our immediate clinical team without your written permission. So if, for example, you were working with another provider in the community and you wanted us to talk with them, we couldn't do that until we had both signed a release of information at your request, and that would tell us what exactly we could talk about, and it would specify the time period for how long we could share information.
Okay.
Does that make sense?
Yes.
So there are a couple of exceptions that occasionally come up, and in those circumstances, we cannot protect the privacy of your information. And those are if we learn that you're at risk for harm, or somebody else is at risk for harm. For example, if we learned that you were suicidal and had a plan to kill yourself, we couldn't protect that information. We would have a duty to report it. And the reason that we would do that is because we have a higher obligation to try to protect your safety.
Okay, I understand.
Okay. So I always feel better if the client can just sort of repeat back to me what your understanding is of our confidentiality policy. So in your own words, can you just tell me how you understand it?
I understand your policy that you won't share my information with anyone else unless I give you permission.
Yep.
And that you will hold all my information confidential unless I plan to hurt myself or unless I plan to hurt other people.
Yeah, okay. Great, thank you, Lucetta. Now we can get back to talking about what brings you in today. So tell me what your concerns are.